Good morning, good afternoon, good evening, whatever time it is you're watching this. Um, How was your week? Did you do anything fun this week? I realized we didn't really do anything this past week. So, we did out and did some stuff, but we didn't really actually do anything this week. I realized earlier. It's crazy. Anyways, we'll change that this week. Huh. But so I was on a call the other day and I realized we were having a chat with this, and then a lot of people don't realize the difference between burnout and compassion fatigue. So we're going to talk about the difference of that today, and then we're going to dive into it a little bit more next week. But the difference between burnout and compassion fatigue. Burnout stems from chronic workplace stress that isn't significantly managed, that can cause intense mental, emotional, and physical exhaustion. Unlike temporary stress, burnout is a persistent condition that impacts everything from daily motivation to connecting and dealing with work responsibilities, work responsibilities. So it's something that is, like I said, it's not temporary. It's something that happens over time. And it's stress from work. And yes, poor management from work, people. Common burnout symptoms and signs include severe physical and emotional exhaustion, a growing sense of cynicism towards a job or responsibility, a noticeable decrease in on-the-job efficiency, feeling in or easily detached from responsibility, and reduced productivity, and lack of accomplishment. All of those are signs of burnout. All those are signs of stress too, but all of those are signs of burnout. Now, compassion fatigue is also known as secondary trauma or vicarious trauma. It is the state of physical, mental, or emotion exhaustion that occurs when you experience prolonged exposure to someone else's suffering. You get a lot of that in what you do because people care about their animals. I care about my animal. I definitely care about my animals, but I care about other people's animals as well. And I care about animals in general, and I never want to see them suffer. And, people in this field feel the same way. So every one of you, I don't care what job you do in the veterinary medicine, you are prone to compassion fatigue. If you were in any medical field or caretaker position, you are prone to compassion fatigue, okay? Because you get it from other people, other things. So it's a common experience for family, caregivers, or anyone in a helping profession or position. Now, common compassion fatigue symptoms and signs are feeling hopeless, having a decreased ability to empathize, emotional numbness, experiencing a sense of detachment from your surroundings, anxiety, irritability, physical symptoms like headaches and gastrointestinal issues. Now, for us women, that could be once a month. That literally sounds like what we go through with our menstrual cycles. But yeah, don't confuse the two. Now, interesting enough, a Talkspace therapist, Cynthia Catchings, says that compassion fatigue often manifests subtly over time, sometimes not allowing the individual to recognize the signs. Hence, it is important to observe if emotional exhaustion, anger, or irritability, difficulty concentrating, and sleeping disturbing or frequently experienced. So that's literally, that's important to know, because compassion fatigue is something that can easily be missed, because it can be, again, misconstrued for something else. As us, women, a lot of those signs and symptoms we deal with our menstrual cycle once a month, or even heading into perimenopause and everything. So our cycle, those signs and symptoms are natural for other things. So compassion fatigue can be easily missed and construed as those things. So it's important to know the differences, that compassion fatigue is tied to the empathy and care you give people in distress, whereas burnout is generally linked to work-related stress and causes a gradual depletion of energy. Let me repeat that. The difference between compassion fatigue and burnout is that compassion fatigue is tied to the empathy and care you give people in distress, whereas burnout is generally linked to work-related stress and causes a gradual depletion of energy. It is important to know the difference, know the signs, so you can figure out and start taking steps to work through it. If you're experiencing burnout versus compassion fatigue, you're going to do something different for burnout than you probably would for compassion fatigue, right? Like, if burnout is something stress related at work, some of those things you can control. Whereas what I mean by that is, if there is a situation that going on at work that is stressing you out, sometimes you can go speak to a manager or someone about that situation and come up with a solution to resolve that situation. Whereas with compassion fatigue, you can't. Like, that's something that you have to work on outside of work, if that makes sense. You can't go to work or go to a manager and have them fix compassion fatigue for you. Whereas with burnout, if something at work is causing it, you can kind of fix that a little bit. But also too, with both of them, you have to know the difference. I always say you have to know the difference, so you know what will help you to work through it, right? Like, if you're burned out from work, coming home, playing a video game, and could help you work through your burnout and debrief with burnout and help you with that. Whereas then it might not help you with compassion fatigue. Compassion fatigue may be something like meditation, or doing yoga, or taking walks through, as we call it, forest bathing, or hiking, walking through those. Like, those things may help a little more with compassion fatigue and burnout versus just one or the other. So it's best to know, so you know what you need to do to be able to help yourself with that, right? And then also too, like, most importantly, know it's okay to ask for help and to utilize the resources available. I talked about this a couple of videos ago, I think it was, where there are so many different resources out there available. I know sometimes they're kind of hard to find, because it's like, where do you look? They're not all in one place. But utilizing those resources, a lot of them are free, because a lot of them are through nonprofits. Like, you have NOMV with Not One More Vet. There's Not One More Vet Nurse. Get on forum boards and look for them. They're out there. If we don't utilize them, they're going away. Yes, they're needed, but if they're not utilized, they will go away, because they're like, oh, nobody's utilizing this. We're just spending money on this. They're going to go away. So utilize them. It's okay to ask for help. That just helps make you stronger. It doesn't make you seem like you're weak or incompetent and can't handle anything. how do you think strong people become strong people? They utilize their strengths, and they work on their opportunities. They have other people help them work on their opportunities to make them stronger, right? As I used the example before, I had, when I was in my retail life, there was a store manager. He wasn't a good salesperson. And of course, one of the things in retail is you got to keep your numbers up, right? He wasn't a good salesperson. So what did he do? He hired a team of people who were really good at selling. So his numbers were still up because he hired the team to help him to sell better, to keep those numbers up. Same thing. Okay. So again, people are here to help you. You need assistance to work through these things. If you don't know, it's okay, because you have an expertise. Your expertise is helping animals. And that's a good thing, because not many people have that expertise, right? So remember when I talked about veterinary school is the hardest school to get in. It's harder to get into veterinary school than medical school, right? So you have a niche expertise. You are very smart. You're able to help animals. Utilize that. Let somebody else help you so you can do your job better. And it's okay. It's no different than, or you can look at it as like, when you're at your job, think of the tools you utilize, right? You yourself cannot, stitch up a wound repair, right? Like when you're closing a wound repair, like you need, you got to have other people to help with, if they're under local anesthesia, you have to have people, if you're the veterinarian, you have to have people handing you tools to be able to, get out, clean everything out. You got to have people to help you do that, right? So you got to have the sutures. You have to be, the suture lines to sew it up, or even, if you decide to glue it, like you have to have those little small resources and other people help you to accomplish that goal, helping that animal, right? Same thing with the other resources. You're going through a situation, you need these other things to help you get through that. Utilize it. It's okay. Just look at it as a resource for this goal that you need to accomplish right now. And that goal is to work through your burnout, prevent your burnout, work through your compassion fatigue, help to prevent the compassion fatigue. Like you need those resources to be able to do that. Okay. And so there are people who have done a lot of studies, a lot of research on this, for these things, to say, hey, try this, it might help. And you know what? If it doesn't, that's fine. That means there's nothing wrong with you or nothing wrong with that particular resource. It's just meant it's not meant for you. Try something else. You got to find what works for you. So try those other things as well. Okay. And find out what works for you and keep going through it. Again, like I said, that one size suture might not work. So you need to get another size suture, right? Or type, not size, but the thickness of the suture, right? So same thing, right? So if it doesn't work on the animal and you need another try something else or do something else, same thing with the resource. If it doesn't work on you, then try something else until you find what works. You do the same thing in medicine, right? You find what works. Same thing. That text, you do that. The e-collar doesn't work, you got to grab another e-collar, right? Because it just doesn't, that size catheter or that size band for doing blood pressure is too big, too small, you got to grab another one, right? Same thing. CSRs, same thing, guys. Oh, they this payment plan doesn't work, or this scratch pay doesn't work, apply for care credit. Like utilize other resources. Like you have other resources you utilize at work. Same thing with yourself, with burnout and compassion fatigue. Use your resources. There's nothing wrong with them. That's what they're there for. Okay. All right. Speaking of resources, you have Lifeboat with NOMV. That's the peer-to-peer. You can speak to someone within your field. So whether you're a technician for small breed animals or livestock. Same thing with veterinarians. They pair you up with people in the similar area of veterinary medicine as you. So Lifeboat is free, so you can chat with someone else, right? Now, keep in mind if you need, that's more of a 48, 74-hour turnaround time. So that's not immediate. But if you kind of want somebody to talk to, talk things through, you have that. You also have 988. If you need to talk to someone immediately, if you're having thoughts that are not good, 988, you can call or text and speak with someone immediately. Same thing with 741-741. Call or text, or no, text, not call. Text and speak to someone immediately. All right. Now, inspired by an old poem, you may not know that the world needs you, but it does. For no one else can smile your smile, say your piece, or shine your light. You are unique, and you alone can fill your place. If you were not here to shine your light, what would happen to the pilgrims passing by your empty place in the darkness without your light to help them on their way? You may not know the world needs you, but it does. Remember, what you do matters, and the world is a better place with you in it, dear person's company. Thank you for watching, and we'll see you next week, and we'll take a deeper dive into this next week. Maybe we'll have a special guest, hopefully, if I can convince them. We'll see you next week, guys. Do something for yourself.